We're actually keeping up with healthcare growth, and despite all the challenges we have in healthcare, healthcare continues to grow at mid-single digits. And Andy, the nature of our business, it's so essential to healthcare. We're at the core of how decision making is made in healthcare. It's a 2% cost category of healthcare spend, but it represents about 70% of the information that physicians will need when making that costly next decision in healthcare. And that's whether you get a prescription, or whether you go see a physician, or whether you go into the hospital, or whether you go home and come back again in a year. So in that, we have the most sophisticated testing, the testing we actually design ourselves with our MD PhDs, and the most basic testing, cholesterol testing, glucose testing for diabetes. So a wide range. And we touch about 1/2 of adult Americans, of course, of 3 years. So we're extensively within the healthcare delivery system of the United States.
What are some of the most cutting edge tests that you're doing? What is sort of over the horizon for you guys?
So a good example of that is all our genetic-based testing. And a good example that people are familiar with is the BRCA test. So if you have a history in the family as a woman, it's important for you to take this BRCA test. And there's a significant predictive value of that test of whether the family member or yourself will get breast cancer or cervical cancer in your lifetime.
So I want to ask you about a company that appeared to be a big rival. And that is Theranos,
Yes.
which attracted a lot of attention and then turned out to be, if not a fraud, maybe tantamount to a fraud, certainly being investigated, subject of a book by John Carreyrou from the Wall Street Journal that we both read.
Yep.
How did that affect how people think of your business, and what did you learn from it?
Yeah, the interesting part of Theranos and what it brought to this marketplace, it actually increased the visibility of what we do. And where I started with, it was that, it became aware through their story that testing is so essential to better health and well-being. And the company brought that forward. And second is, with that, it actually brought to the marketplace the concepts that consumers should have access to laboratory testing without seeing a doctor. And they actually laid some of the groundwork for that to happen in the state of Arizona. And last year, we introduced a new direct-to-consumer product offering because of that early work. Second is, we're now in retail stores, and they did some of this too, and we're doing that as well now proactively. We did this in Safeway stores. We have a joint venture with Walmart. So many retail settings now have the capability of your blood drawn and have more of the convenience with this essential, necessary information for how you live a healthy life.
But were you surprised that this company turned out to be not all that?
Well, obviously, we're in the middle of the marketplace. So we knew what was happening, what was not happening. And it was difficult for us to say, what's not happening. But in the end, the truth is being told of what was being delivered. And it also points out, Andy, how difficult it is to do what we do well. We're a regulated industry. We have CLIA, which is how we get regulated by the laboratory industry. And to deliver on that information, which is so critical, we have to get a lot of things right. And in that story, it was obviously not easy to get a lot of things right. And we do it right every day, and we're proud of that.
Interesting that there was sort of a silver lining in that whole saga for you guys.
There was.
Yeah. Let me ask you about healthcare costs. I know you must get asked this a lot. Healthcare costs in the United States are more than anywhere else in the world, rising faster than GDP. And that has been a narrative that's been going on our entire lifetimes. I mean, why is that? And more importantly, what can we do about that to get those costs under control?
Yeah. So as I said earlier, healthcare costs, despite our work, has been growing up mid-single digits, and it's approaching 20% of GDP. But it's a little misleading, Andy, because if you look at the full facts, and if you look at what we spend in the United States on social programs, we're somewhat in the middle of the pack. We don't spend as much on social programs as other countries. But with all that, all the work that's gone in healthcare, frankly, we haven't spent enough time on really transforming how healthcare is delivered. And I would argue the best opportunity for the system is to really take a hard look at the expensive lives in our healthcare system, the 5% of lives that represent about 50% of cost, and really spend time on bending the cost curve. And actually, we self-insure about 60,000 people at Quest Diagnostics. And we've done this work at Quest, and we proved that it can happen with more tenacious detail around transforming the healthcare delivery system.
Steve, where do you stand in the debate or battle between Donald Trump, for instance, and the ACA?
Well, the ACA if you think about the Affordable Care Act, a big portion of what we spent time on is access to healthcare insurance. And we did add some access. And when you have more access, it's good for us because you need clinical testing, which is at the core of healthcare delivery. And there's some good things that came from it. The ability for us to be portable and have insurance stay with us, the ability for our 26-year-olds to stay on our insurance programs. But along with that, as I said earlier, we haven't spent enough time on transformation and really bending the cost curve, the Affordable Care Act. And so as we go forward as a country, I think we need to solve the problems that we haven't solved yet, continue to look at access in terms of insurance access, but put our shoulder into really transforming healthcare that is better quality at lower cost.
Does that mean working within the framework of the ACA or repealing it?
Well, I would say we should work with the system because it's complicated, Andy. Anything that's grown up as we have in this country takes time. So I think there's a way that we can adjust what's wrong. We can work with what's right and sensibly and pragmatically improve the quality of healthcare and lower cost.
So Democrats, most notably Alexandria Ocasio-Cortez, are pushing a Medicare for All plan, and most people seem to support that. What are your thoughts on that?
Well, the unfortunate reality is most people don't understand the basic economics of healthcare in the United States. The majority of people in the United States get their healthcare from their employers, like Quest Diagnostics. As an employer, actually a product of the ACA, Affordable Care Act, we pushed more of our costs to our employees. About 30% of our healthcare cost goes to our employees. And if we didn't do that, there was a thing called the Cadillac Tax,
right,
which is part of the Affordable Care Act. And so the majority of healthcare costs is actually paid by employers and employees. And so if you look at the $3.5 trillion spent on healthcare costs, that portion is actually funding the Medicare and Medicaid programs throughout this country. And actually the reimbursement for those two pieces are below cost in some cases. So if we think about Medicare for All, we really need to think about what's the funding mechanism going to be, because if it's funded through corporations and through employees, I don't think that's a side that could clearly afford to provide that access as described. So I don't think the details have been worked out on the principle of how this could be affordable.